Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. Today's topic of discussion is hormonal preparations for contraception. When hormonal contraceptives are properly used, they are the most effective spacing method of contraception. Oral contraceptives of the combined type are almost 100% effective in preventing pregnancy. They provide the best means of ensuring spacing between one childbirth and another. Now let us look at the classification of hormonal preparations. We have some oral preparations and then some depot formulations. Oral preparations, we have combined pills, progesterone only pill or POP, postcoital pill, once a month pill, also known as long acting pill, and also male pill. Out of this, you can see I have put an asterisk mark against the postcoital pill because this topic will be discussed in our next video, not in this particular video. Then we have the depot formulations, which are slow release formulations, and there we have the injectable preparations, subcutaneous implants, and vaginal rings. So let us talk about them individually. First, the combined oral pills. As the name suggests, they are combined preparation because we have two hormones, estrogen and progesterone, mostly the synthetic preparations. The action is to inhibit ovulation by blocking secretion of gonadotropin from pituitary gland. That is the mechanism of action. Progesterone also has its action on the mucosa. It thickens the mucosa of the cervix and then prevents the entry of sperm in the genital canal. The commonly available oral contraceptive preparations are Maladi and Malayan, and both of them contains levonorgestrel 0.15 mg, which is a synthetic progesterone, and ethinyl estradiol 0.03 mg, which is a synthetic estrogen. Maladi is a package of 28 pills, and out of these 28 pills, 21 are the oral contraceptive pills, and the rest 7 pills are brown film coated 60 mg ferrous fumarate tablets. So basically iron preparations, and they are made available to the consumer under social marketing at a price of ₹3 per packet. So remember, Maladi is available at subsidized rate under social marketing, each strip costing ₹3. And then also we have the Mala N, which is supplied free of cost through all PHCs, that is primary health centers, urban family welfare centers, etc. So this is Mala N. These are the images of Mala N and Mala D. You can see both of them contain levonorgestrel and ethinyl estradiol. Here also, if you look at the back side of the Mala N, there is ethinyl estradiol, and in progesterone we have norethistone acetate. So these are Mala D and Mala N, which are combined oral hormonal preparations. These pills should be taken every day at a fixed time, preferably before going to the bed at night. The first course should be started strictly on the 5th day of the menstrual period, as any deviation in this may not prevent pregnancy. So what we are doing here, we are advising the woman to start the medicine for the first time on the 5th day of the menstrual cycle. Then she should be taking this pill every day at a fixed time. If the user somehow forgets to take a pill, she should take it as soon as she remembers, and then she should take the next day's pill at usual time. What are the merits and demerits of oral combined hormonal preparations? Merits are they are 100% effective if they are taken regularly. They are easy to use and does not interfere with coitus. They reduce risk of anemia because there is less menstrual bleeding, and they also reduce the risk of pelvic inflammatory disease, cyst, uterine cancer, etc. The demerits include minor side effects like dizziness, nausea, vomiting, headache, weight gain, and breast tenderness. there is increased risk of cardiovascular disease if the woman is already at risk. That means there are some risk factors like obesity, hypertension, dyslipidemia, etc. They can also increase the risk of hepatocellular adenoma, gallbladder disease, cervical carcinoma. Next one is progesterone only pill or POP. They are also known as mini pill. They contains only progesterone and they act by thickening the cervical mucosa. They have to be taken throughout the menstrual cycle, but there is high failure rate, and that is why this option is not very popular among the users. Once a month pill, they are long acting pills. They are modified combined oral pills since they contain both estrogen and progesterone, and they contain the long acting estrogen and short acting progesterone. Now they are not in use and also not very commonly advised to the couples because of high pregnancy rate. So there is high failure rate and there is also irregular menstrual cycle. Then we have male pill. There have been researches going on for so many years to find out the ideal male pill, and the main line of approach for this research is to find out a pill that will prevent spermatogenesis, that will interfere with sperm storage and maturation, that will prevent sperm transport in the vas, and also that will affect the constituents of the seminal fluid, but the main mechanism of action is preventing spermatogenesis. An ideal male pill contraceptive would decrease the sperm count by preventing spermatogenesis, but the testosterone level should be at normal level. Now the problem is the hormones that suppress sperm production also tend to lower the testosterone and thus can affect the potency and libido. That is why this is not a very successful option, although researches are still going on. There is one option that is made of gossypol, which is a cottonseed oil derivative, but the problem is it produces azoospermia or severe oligospermia. So that means the sperm count is very low. These are the demerits. As many as 10% of the men using this male pill are either permanently azoospermic, or sometimes because of the gossypol, which is a cottonseed oil derivative, it can also have some toxic effect on the user. What are the mechanism of action of oral contraceptives? When we are using the combined oral pills, it prevents the release of ovum from the ovary. So ovulation is suppressed, and this is achieved by blocking the pituitary secretion of gonadotropin that is necessary for the ovulation to occur. Progesterone only pills render cervical mucus thick and scanty and thereby inhibit the sperm penetration. Progestogens also inhibit tubal motility and delay the transport of the sperm and of the ovum to the uterine cavity. So these are the different mechanism of action of the hormonal preparations, oral preparations. Adverse effects of contraceptive pills: there can be cardiovascular effects. There are some associations found with excess mortality among the women, and that is due to the cardiovascular events like myocardial infarction, cerebral thrombosis, venous thrombosis, with or without any pulmonary embolus. There are also some possible association with cervical carcinoma. Some metabolic effects are there like elevation of blood pressure, dyslipidemia, especially the HDL, that is high density lipoprotein, is decreased. There can be blood clotting, hyperglycemia, hyperinsulinemia leading to insulin resistance, and then diabetes. Other side effects include liver disorders like hepatocellular adenoma, gallbladder diseases. The quantity and constituents of the breast milk may be affected because of the high dose estrogen. There may be delay in conception even after stopping the pills. And with progesterone only preparations, some ectopic pregnancies have been reported. Possible birth defects can occur, and these defects occur when these pills are taken during the pregnancy or just before the pregnancy. Common unwanted effects include breast tenderness, weight gain, headache, migraine, and also breakthrough bleeding or spotting. What are the contraindications of contraceptive pills? There are some absolute contraindication and some special problems that require medical surveillance. Absolute contraindication includes cancer of the breast and genitals, liver disease, any previous history of thromboembolism, cardiac abnormalities, congenital hyperlipidemia, undiagnosed abnormal uterine bleeding. So these are the situations when the oral hormonal preparations are absolutely contraindicated. They cannot be given. There are some situations when these hormonal preparations can be given orally but under medical surveillance. For example, if the woman is above 40 years of age, or if she is above 35 years of age and she smokes, if there is history of mild hypertension, chronic renal disease, epilepsy, migraine, nursing mother in the first 6 months, that means when she is lactating, diabetes mellitus, gallbladder diseases, history of infrequent bleeding, amenorrhea, etc. Some depot formulations are there. We have some long-acting hormonal preparations which are given as depot formulations. There are injectable preparations, subdermal implant, and vaginal ring. In injectable preparations, we have progesterone only preparation and also the once a month combined preparation, which are newer preparations, and they are given once a month. They contains both estrogen as well as progesterone. Progesterone only injectables. The first option is the DMPA, that is dipomedroxyprogesterone acetate. These are the images of the DMPA. You can see it contains 150 mg of DMPA per ml. They are injected every 3 months. It acts by suppressing ovulation and also has action on endometrium, fallopian tube, and cervical mucus production. There is another option, that is Neten, also called the norethisternone enantate. It contains 200 mg of progesterone and they are injected every 60 days or 2 months. They act by suppression of ovulation and also has action on cervical mucus production, and both this preparation contain synthetic progesterone. The initial injection of both DMPA and Neten should be injected during the first 5 days of menstrual period, and this is very important to rule out the possibility of any pregnancy, and both are given by deep intramuscular injections. Now there is another preparation, a low dose formulation of DMPA, that is Depo Subq Provera 104, also known as DMPA SC, because it is injected subcutaneous rather than intramuscular, and unlike DMPA which contains 150 mg of the progesterone, it contains 104 mg of DMPA. So and this also is injected every 3 months, just like the DMPA preparation. So that is DMPA SC. What are the merits of this injectable progesterone preparations? They are easy to administer, they are highly effective and reversible, and they do not interfere with lactation. But there are certain contraindications like abnormal uterine bleeding, malignancy of the uterine tract, and suspected malignant growth, breast carcinoma. In these conditions, they are contraindicated. They should not be injected. Combined injectable contraceptives, as the name suggests, they contain progesterone as well as estrogen, and they are given at monthly intervals, plus minus 3 days. They act mainly by suppression of the ovulation. The cervical mucus is affected mainly by the progesterone component, and it becomes an obstacle to the sperm penetration. There are also some changes produced in the endometrium which makes it unfavorable for the implantation if fertilization takes place, which is extremely unlikely. So fertilization, first of all, it is very unlikely because of the progesterone, since it is suppressing ovulation. But if fertilization by any chance takes place, the implantation is not very easy because the endometrium is unfavorable for implantation. So these are the mechanism of action of the combined injectable preparations. Next, we have the subdermal implants. So we have Norplant and Norplant R2. Both of them contains levonorgestrel. Norplant consists of 6 stylistic capsules, which are basically silicone rubber tubes containing 35 mg levonorgestrel each of them. So 6 into 35, that is 210 mg total. On the other hand, Norplant R2 comprise 2 small rods. So that is the difference between Norplant and Norplant R2. As the name suggests, this R2, there are only 2 small rods, whereas in Norplant there are 6 stylistic capsules or silicone rubber tubes. Both of these devices are placed under the skin of the forearm or arm, and the implants allow a steady diffusion of steroids into the bloodstream for a period of 5 years to give effective contraceptive effect. So these are the images. This is a Norplant preparation. It contains one set of 6 subdermal implants. These are the cyelistic tubes or capsules, and here in this image they are being placed under the skin. You can see there are 6 markings where the 6 capsules will be implanted. This is a Norplant preparation. Then we have the vaginal ring, which contains levonorgestrel, and they are also very effective. The hormone is slowly absorbed through vaginal mucosa since these rings are placed inside the vaginal cavity. Now, as they are not oral preparations, they can bypass metabolism in the gastrointestinal tract as well as the liver. And because of that, we can use very low dose of levonorgestrel in the vaginal ring. They are to be worn in the vagina for 3 weeks of the cycle, and they are removed for the 4th week. So with this, we conclude today's session. We have discussed the different hormonal preparations that we have for contraception, where we discuss the oral preparations like combined pills, progesterone only pill, long acting pill as well as male pill. And then we have the depot formulations where we discuss the injectable preparations, the subdermal implants as well as vaginal ring. So if you like the video, please subscribe to our channel and share this video with your batchmate, junior and friends from other colleges. We also have a Facebook page that you can follow. The link is given in the description. Take care, and we shall see you in our next video.